Welcome back, everyone, to Open Line. Glad you are with us tonight. It is Wednesday, May 27th. We're talking about the coronavirus pandemic, of course, and its impact on the homeless community here in Nashville. There is a site set up at the fairgrounds where people are taken if they test positive, and we've talked a little bit about that site, and we're also talking about some of the encampments that still exist throughout Nashville. We have with us Paula Foster. She is chair of Metro's Homelessness Planning Council, and Dr. Sheryl Fleisch. She is the medical director of Vanderbilt Street Psychiatry and Homeless Health Services. We were asking Dr. Fleisch as we went to the break about how often you were on before, and you were part of a documentary where you went out to these encampments. Are you still able at all to go to the encampments, or what have you been able to do since this whole thing has started?
So we've gone out a couple of times. We provided vaccinations for folks for a hepatitis A outbreak. But other than that, we're predominantly doing phone calls with the help of one of the nonprofits that we work with. And we're still providing medications for the patients with whom we work. We do not want to expose them to us in case we are asymptomatic carriers. But it's definitely been a huge challenge, and we're trying to figure out a better mechanism so that we're able to still serve the patients with whom we've always been working for the last 6 years.
And what's at stake? If we don't find a better method, as you say, or if there's not a vaccine, what's at stake? I mean, what if you're unable to go out there for several months? What's at stake?
Oh, people's lives are at stake. People are going to die. We have to figure out a way to obtain rapid testing for individuals on the streets, and any individual who is really in any congregate setting. That includes nursing homes, sober living facilities, shelter settings, or congregate living outside. And for us, I mean, we provide basic health care and psychiatric care to folks who experience homelessness when they are unwilling or unable to go to another setting. So we're really their lifeline to healthcare. And so we have to get out there.
Okay, let's go to Daryl, who is waiting here on the phone. Hello, Daryl.
Yeah, good afternoon to you guys. I'm concerned about the homeless, not just because of the pandemic. That's just something that's added and compounded to the already problem that we have in Nashville. I see that we have a lot of different organizations that are there to help the homeless, whether it's Salvation Army, Room in the Inn, United Way. And I would just like to see all these organizations get together and come up with a plan, a one-stop plan where we can assess the homeless people, check them out for any medical conditions, check out mental health services that may be needed, and make sure we can pretty much get these people in one door, and by the time they come out the other door, we've at least given them some tools to work with to hopefully eliminate some of the homeless that we have right now in Davidson County. And I'll listen to both of your guests for their response as well. Thanks.
Okay, all right. What do you think about what Daryl said? Paula, I'll start with you. What do you think about that?
Well, Daryl, thanks for calling, and I share your concern. And let me just tell you that there are so many organizations in this city that are doing incredible work, and we are doing some coordinated planning around that. That is what the Homelessness Planning Council does, and many of those providers have a seat at that table. So one of the things that we have established over the last few years is what we call the coordinated entry system, so that we try to make sure that when one organization touches someone who is homeless, that individual the information is put into one place, so that everywhere that they access services has access to information that's going to help us help that person. You know, one of the biggest issues that we have, and the answer to solving the crisis of homelessness, whether it's during the pandemic or beyond, is housing. And there's not enough of it, and there's not enough affordable housing. And the city has to figure out a way to do better when it comes to utilizing resources to make more affordable housing for folks who have no income or very low income. And we're not talking about workforce housing. We're talking about housing for folks who don't have enough money to put themselves into any kind of housing. And that's very difficult. You've got people who have long-term mental illnesses. You have folks who just for a variety of reasons, have not been able to sustain permanent housing. And we've got to figure out a better way to do that. And working together, we can make that happen. But we can only do so much as individual nonprofits. We have to be able to have a city that's willing to partner with us and make that happen.
And I'll share that same question with you, Dr. Fleisch. I mean, you heard what Daryl said. I detected perhaps frustration on Daryl's part. He's basically saying, I wish we could all just come together and solve this issue and work together. I mean, it sounds like there are certainly a lot of nonprofits that are working and there is coordinated effort. But when you hear what Daryl said, what do you say, Dr. Fleisch?
I think really he has a two-part question with maybe a two-part solution. There are some cities around the country that have sort of what he is talking about. Boston's Healthcare for the Homeless, Sulzbacher Center in Jacksonville, Florida, where basically they have an incredibly large physical site that literally has everything that he is talking about in one physical site. One of the things that we have in Nashville is that we have a lot of the resources that he's talking about, but they are literally all in multiple different physical sites. And so somebody has to go on a bus and go 15 minutes to a mental health facility and then go another 15 minutes to a physical health facility. Sometimes they're in the same spot, but then, another 15 minutes to another place, and then they have to get a bus pass and go somewhere else. And so all of those different things in different physical locations make it really difficult for provision of care. Obviously, we also didn't expand Medicaid, which makes it objectively very challenging. But one of the things that when I've gone on different site visits at other places that have really impressed me is when you literally have everything in one very, very large physical space, it can actually allow different organizations to provide their services in the physical space and make that a lot easier. So that's one thing that our city can consider. But I think the second thing that he's talking about is basically that, again, COVID just brought up all the inequities that already existed before, and that while there is a solution to homelessness in the United States, and like Paula said, that solution is housing. In Davidson County, minimum wage is $7.25. And you would have to work 97 hours a week to be able, on minimum wage, to be able to pay for a one-bedroom apartment in Davidson County, which would be $911 a month is the average rent for a one-bedroom apartment. And so right now there are only something like 22 counties in the United States that have what's called affordable housing or fair market rent, which is 30% of your income. And disability income is only $783 a month. So we have individuals who experience homelessness who literally work and just can't afford rent. And so this is a problem that happens. This is a problem that's going to even take more than our city coming together. And I think that's what Daryl is talking about. So I agree with him that this is a huge issue and something that the federal government and the entire United States is going to have to come together on.
Money is something that's in short supply. It's always in short supply. It's now in short supply more than ever. We're talking about a huge property tax increase here in Davidson County. But it's interesting to hear you say the minimum wage. And I think there are a lot of people, and Paula, I'll have you respond to this, and certainly Dr. Fleisch just touched on it, that think the people that are experiencing homelessness aren't out working. And Dr. Fleisch just said, if you raise the minimum wage, that might make a difference. I mean, how much of a difference would that make? What are some of the misconceptions and kind of combat those misconceptions?
Well, sure, Ben, thank you. I think one of the things that is a huge myth is that every person who is homeless is living under a bridge and is, just too lazy to work or, is addicted to drugs or mentally ill. And that's just not the case. Of course, that's a percentage, but the makeup of folks who experience homelessness is no different than the makeup of the general population. They come from all walks of life. They have all kinds of educational backgrounds. They have all sorts of things that happen. And many of them are what we call the working poor. They're working, but they can't afford rent. They can't afford they're living paycheck to paycheck. They're living, day to day, and they to be able to save up enough money to put a deposit down on an apartment. They don't have enough money to pay their rent every month when it's $900 a month, and they're only making $700 a month, and that's for everything. It's untenable, the lack of sometimes the empathy I think that we have for folks who are struggling, and it's one thing I think for us, particularly in a time like this. We've all circled together, and we've brought our networks in, and we've come together in a very tight circle, and we kind of have left the big issues to other people, and we expect that those big issues, particularly from a government perspective, are being taken care of, and sometimes they're just not. And it's not just around COVID. This is something that had brought some of the, as Dr. Fleisch said, the inequities have been brought to light.
Let's go to Billy now. Hello, Billy? Are you there,
Hello.
Billy? Yes, hello.
Yes, I am.
All right, go right ahead. Go right ahead.
Now, what I want to stress, and I'm glad you gave me the opportunity to come on and say this, and I thank you for that, is I was working, and I was homeless, went through a bad divorce and whatnot, and I had to go to work hungry, and I had to beg the job at the hotel for food, and sometimes they get it, sometimes they don't, and just scrap around the street before I went back to work at night, and my stomach was growling and everything. The thing that irritated me the most, it took me a long time to get housed to the VA rather than homeless people. And so when I went to the projects, walked the streets, I see these young men and women living in these projects who had no business being there, for no other reason. And then you got a veteran, a government employee who's been working all these years and not sitting around for a handout, can't even get a place. And that really irritated me, because these people are getting child support and living in the projects. Lord have mercy, what is going on with this world? And I'm having to pay child support, but somebody living in the projects is just paying $50 a month rent. These places are meant for people that serve in the country and serving the people working, staying out of trouble like me. And that really irritates me. I don't care if you're black, white, or whatever. Right is right. When you
So, Billy,
like at work.
are you a veteran? Is that what you're saying?
Yes, I am.
And you experienced homelessness?
Yes, I was homeless. And not only that, I was military police, and then I got out, I was a correction officer. And if I hadn't treated people right, being a correction officer, I'd be dead, because people knew I treated them right in there. I had no problems with guys that I was overseeing in the correctional system. And that's why I always treated them right, and and when they wanted food, extra, whatever, I tried to help them out the best I could, and referred them to jobs before they got out. But the thing that irritates me, when you see these young men and women in the project selling this dope and living in there, had no business being there, and you got people serving this country, something is really wrong with this system.
All right, Billy, thank you. Thank you for sharing your story. Thank you for that. Dr. Fleisch, what do you think as you hear what Billy had to say there?
Yeah, I mean, I think he highlights a really important issue, which is simply that there literally is not enough housing available, and it doesn't matter what walk of life you are. One of the goals really every year has been to end veteran homelessness. I think across the United States, there have only been a couple of cities that have I actually don't know the statistics on it, to end veteran homelessness, but what it seems like is every year we push it back. So it's like end veteran homelessness in 2005 and then end veteran homelessness in 2010. And I think what he's highlighting is that even within homelessness, there are inequities. So we use different scales in the homeless population to try to figure out who is the most vulnerable, or who has the greatest right to housing. And what happens is if you only have 10 vouchers per month, let's say, and you have hundreds of people who are experiencing homelessness. Who are we to say who has the right to that voucher and who is the most homeless? Or do you say, well, you're a veteran and so you deserve this voucher, or you're in a wheelchair so you deserve this voucher, or you're over 65 so you deserve this voucher? I think one of the things that he's highlighting is that he served his country, and I don't think any of us would say that he in any way, shape, or form deserved to be experiencing homelessness. I think the other thing that he's highlighting is that everybody has a basic right to health care. Everybody has a basic right to housing. And what we aren't doing is we aren't providing that as a nation to individuals. And because of that, we've really had this incredible snowball effect. And then I would say, lastly, since our conversation is also focusing on COVID, research right now, even though it's early, is really suggesting that anywhere from probably 40 to 45% more people are going to become homeless because of COVID. So we already have this incredibly small housing market. And so what's going to happen when even more people are homeless? And then that he's going to have more people fighting for this housing voucher that he's already struggling with. So I'm so pleased to hear that at this point he's no longer experiencing homelessness, but this is definitely a chronic and very serious issue.
Billy, yes, thank you for sharing that. All right, we're going to take a break. We have a couple more calls. Hold on the line if you're on the line. If you want to call in, there's the number 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.